Assalamu alaikum wa rahmatullahi wa barakatuh. Today our lecture about the bad habit. اليوم موضوعنا يختلف. المحاضرات اللي فاتت حكينا عن development of occlusion واليوم راح ندخل بموضوع جديد اللي هو habits أو bad habits. We need to know what you mean by habit and what is the bad habit. Habit can be defined as fixed or constant practice established by frequent repetition. That means any action or practice that characterized by frequent repetition can be defined by habit. While bad habit is the negative habit. That means is a negative behavior pattern and also defined as the action which by repetition had become rhythmic and spontaneous. Bad habits. There are many types of bad habits, but the common types that are more related to our practice include sucking habits, such as thumb sucking, finger sucking, and also lip sucking, tongue thrusting, mouth breathing, and nail biting. Bad habits have specific factors that consider etiological factor for it, which is either nutritive factors or non-nutritive factors. Nutritive factors. That some fetus have been reported to suck their thumbs in utero. As you can see in front of this picture for fetus, ultrasound picture for fetus in utero, he put his thumb in his mouth. لذلك أول ما ينولد هو راح تكون عنده هذه الباد habit فيعتبر nutritive factor. The vast majority of infants continue with this bad habit during the period of 6 months to 2 years or later, sometimes to 4 years. Etiological factor for bad habit. Sometimes the sucking behavior, either thumb sucking, finger sucking, or whatever, are considered normal in infants and young children and usually are associated with their need to satisfy the urge for contact and security. But sometimes, if these non-nutritive factors or these bad habits continue for longer period, this will be associated with some problem. We will talk about it later. There is a specific problem associated with each type of bad habit. So, if these bad habits continue for more than 4 years, a professional evaluated will be recommended. Usually, this considers as a symptoms that the child suffers from emotional starvation and he will, or sometime from afraid from something. So he will use the thumb or finger sucking for comfort and compensation or to get some sense of security. So if these bad habits continue for more than 4 years, a professional evaluation will be necessary. Different types of bad habit, and first of all we will talk about the sucking habit. Sucking habit include either digit sucking or thumb sucking or also lip sucking. Digit sucking is the placement of thumb or finger in a varying depth into the mouth. That means sometimes the child will put only the thumb, sometimes one finger or more than one, and one finger in the mouth, and sometimes he put only the tip of the finger or thumb in his mouth. One other can place the half of the finger or sometimes the whole finger. So this means the varying depth into the mouth. This habit mostly discontinue at age 3 to 4 years. But if it continue after 4 years, so greater risk for dental malocclusion, digit deformities, and speech difficulties will be developed. Also, the severity of this problem will depend on the frequency, duration, and intensity of the habit. That means how much the times that the child will put his finger in his mouth and for how long period, and also the intensity of the habit. In most cases, digit sucking may be associated with learned habit. That's mean mostly with the breastfeeding period. If the breastfeeding period continue for longer than normal, this considered as the factor that may be associated with digit sucking, the duration of feeding time, feeding upset, and also psychological stress, which will appear to have little or no significance in the development of this habit. Habit continue till the sixth age, that's mean with the eruption of the primary teeth, so it can change the growth pattern of the jaw and cause significant misalignment of the teeth. Other types of bad habit is the lip habit. This involves manipulation of the lips and perioral structures. The most common presentation is the placement of the lower lip behind the maxillary incisor. This is the most common type of lip habit that you can see. Although most lip habits don't cause dental problem, lip sucking and lip biting can maintain the existing malocclusion. Include tongue thrusting. Tongue thrusting means protrusion or placement of the tongue in abnormal position during swallowing. To know the abnormal position of the tongue, firstly we must know the normal position of the tongue during swallowing. During normal swallowing pattern, there is a specific step that will occur to get this process. Firstly, after placement of the food in the mouth, the anterior oral seal will be obtained by closure of the upper and lower lips together. Then the teeth will come into a light occlusal contact, and the tongue will be elevated to the palate to manipulate the bolus of the food. Then momentary clenching of the teeth to get chewing of the food as it passes into the pharynx. As I mentioned, the first step includes the anterior oral seal, which can be obtained by closure of the lip. Sometimes this anterior oral seal cannot be obtained between the upper and lower lip due to short or flexed lip. So, this anterior oral seal will be obtained by protrusion or thrusting of the tongue anteriorly between the teeth to come into contact with the lip. This called adaptive swallowing, due to adaptive measure during swallowing. So the placement of the tongue placement of the tongue or thrusting of the tongue anteriorly to get anterior oral seal is called adaptive swallowing. The most common type of tongue thrusting is the placement or thrusting of the tongue anteriorly, but lateral tongue thrust is not uncommon. So, tongue thrusting can be defined as abnormal habit of placing the tongue between the teeth during the act of swallowing process. Causes of tongue thrust. There is specific causes that related to tongue thrusting, which include retained infantile swallowing. That if you can see during normal suckling process, during normal breastfeeding, the child try to thrust or protrude his tongue to come into contact with the breast mammal to get the suckling process. If this infantile swallowing will be retained, so it may be result in tongue thrusting. Also, upper respiratory tract infections that associated with the blockage to the upper respiratory tract. So the patient try to open his mouth to get respiration, and this may be associated with tongue thrusting. Some feeding practice and also other oral habits may be cause for tongue thrusting, or maybe due to neurological disturbance, hereditary factors, or due to large tongue size that cannot be accommodated by the jaw and the teeth, so it will be protruded anteriorly or sometimes laterally. Type of bad habit include mouth breathing. Mouth breathing means that the child or the patient can breathe from his mouth instead of the nose. And there is a specific causes for this type of bad habit. If you think what the possible causes that may make the child open his mouth and breathe from his mouth instead of the nose, you can conclude that these causes may be or mostly may be pathological causes that make obstruction to the airway, such as in polyp or adenoid, which make the child cannot breathe from his mouth, so he will from his nose, so he will open his mouth and breathe from it. The other causes may be habitual. We mentioned at the beginning of our lecture that habitual the thing that occur due by repetition. And these may occur due to the reaction of the child to a specific stimuli, such as some type of cartoon that he is like, or any movies. So he will react to this stimuli by keeping their mouth open and will breathe from it instead of his nose. Or maybe due to other causes that will make the mouth open, cannot close. This may be due to a flaccidity of the perioral musculature. And this flaccidity of the perioral musculature or short lip, which make the anterior oral seal cannot be obtained by the lips. So this can be occurred by a protrusion of the tongue and a breathing of or opening of the mouth and breathing from his mouth instead of his nose. Include nail biting. Nail biting, from its name, no need for definition. It's just by biting on the nail. But there is a specific predisposing or contributing factor that may be related to nail biting, and the major cause may be tension and conflicts either in home or in school. So psychological and social effects are powerful contributory factor for this habit. The other types of bad habit احنا قلنا عنهم انه اغلبهم يبدون بعمر تقريبا بالبداية، وقسم من عندهم ينتهي بعمر 2 إلى 3 سنوات. While nail biting is a habit rarely seen before 3 to 6 years of age. And the number of people who have nail biting will report to increase until adolescence. So when the age increases, the number of people with this type of bad habit also will be increased as a percent. And regarding the complications or problems that associated with nail biting, there is no evidence that nail biting causes malocclusion or dental changes. The most common signs of nail biting, as you can see in front of you, by shape of fingers and also some attrition of the teeth. Be defined as habitual grinding of the teeth. Mostly occur at night, but sometimes occur as the patient wake up or during sleep at day. As the other type of bad habit, there is a specific etiological factor for paroxysm, which may include emotional stress or may be due to neurological abnormalities, tooth malocclusion, and in rare cases as a side effect of some medication. There is specific complications or problem may result from paroxysm, mainly include dental attrition, which associated sometime with enamel wearing of the front and back teeth. Also, some complications include headache, TM joint dysfunction due to heavy pressure during the grinding process, which may be result in soreness or of the masticatory muscle. Also, in severe cases, the paroxysm can result in tooth sensitivity or root exposure due to heavy pressure that result in destruction of the periodontal ligament and root exposure, which required treatment. Regarding the management of paroxysm, there is range of management which ranged from just patient or parent education, or may include occlusal splint and in some cases psychological technique or medications. For children younger than 8 years, the treatment is usually not required. For older children, dentists may recommend mouthguard to be worn at night to prevent the attrition of the teeth and also to absorb the heavy pressure during uh, bruxism. The complications or problem that may result from any type of bad habit depend on the duration of the habit, that's how long this bad habit will be continue, and the frequency of the habit, how many the habit will be repeated during the day, and also intensity of the habit. These the main factor that may related to the problem which result from bad habits. To get correct diagnosis of the habit, a combination of extra and intraoral examination for each type of the habit will be required. These occur by careful asking of the patient or his parent to get a correct diagnosis for the problem. The diagnosis of specific types of bad habit. Firstly, the thumb finger sucking. We have extraoral and intraoral examination to get correct diagnosis of this habit. For extraoral examination, firstly we examine the thumb or digit that can be placed in the mouth, and you can see that it's very clean compared to the other and have dishpan appearance, short fingernail, because when he plays in his mouth this will be prevent normal development of the fingernail, so it will be short and clean, and may be associated with viral or fungal infection because he plays in damp and wet oral environment, so viral or fungal infection can develop. Also on the finger, you can see on the side of the skin, not on the nail, on the side of the skin, you can see patch of hardened skin on the back of the thumb. This due to the pressure from the lower incisor. Also extraorally, you can examine the upper lip. It will be short and hypotonic because it will be stretched. Regarding the jaw, maxillary protruded and mandibular protruded, and also nasal floor will be narrow. Oral examination. The following point can be checked. Firstly, you can see increasement in the overjet. This occurred due to protrusion of the maxillary anterior dentoalveolar segment and retrusion of the mandibular anterior dentoalveolar segment. So protrusion of the upper, retrusion of the lower, this will be increase the overjet due to placement of the tongue between, the finger between upper and lower teeth. Also, localized anterior open bite or incomplete overbite can be seen. This occurs due to placement of the thumb or finger between the upper and lower teeth will prevent the normal development of these teeth or in the labial segment, which can result in anterior open bite. Also, unilateral posterior crossbite can be seen. This type of crossbite can occur due to multi-causes. Firstly, from the action of the buccal musculature. During the placement of the thumb or finger in the mouth, there is some stretching of the buccal musculature, and this will push the teeth or the buccal segment to inside. So this will result in constriction of the maxilla and posterior buccal crossbite. Also, due to reduced intraoral pressure due to placement of the finger, and during the placement of the finger, the intraoral pressure will be reduced because the tongue will be moved down. So the intraoral pressure of the tongue will be prevented, and the extraoral pressure from the lips and oral musculature will be increased. So less intraoral pressure and more extraoral pressure will result in constriction of the maxilla and posterior frostbite can be developed. Intraoral diagnostic feature for tongue thrust include protruded upper and maybe lower anterior segment due to the positioning of the tongue between upper and lower teeth that push it more anteriorly. So this will result in protrusion of the upper and lower teeth, and due to its placement between the upper and lower teeth, this prevents the normal development of the anterior labial segment, which result in anterior open bite. During normal position of the tongue will attach to the palate of the maxillary arch, and during tongue protrusion, the tongue will be lowered. So the intraoral pressure will be reduced and the extraoral pressure will be as it or increased. So constricted maxillary arch can be result. Irregular tongue movement also can be seen. At rest, the tongue tip is lowered, and due to breathing from directly from the mouth, a dry mouth can be a result, which can be associated with anterior marginal gingivitis due to dryness of the mouth, and also caries can be developed. Diagnostic features of lip sucking include during lip sucking, the lower lip will be manipulated behind the upper incisors. So this will result in pressure on the skin below the lower lip, and also this area will be always wet and damp. So eczematous appearance can be seen on the skin due to multiple or repeated infection. Also, due to the pressure from the lower lip on the lower labial segment, because as I mentioned, the lower lip will be manipulated behind the upper. So there is a pressure from the lower lip on the lower or labial segment, which results in retrusion of this segment. Breathing. Because the patient breathes from his mouth, so the paranasal area or the respiratory apparatus will not be used. This will result in underdevelopment of the paranasal area. And according to the growth theories, the part of the body which not be used will be under development. Also, small nostrils and constricted maxilla can be seen. We talk about constricted maxilla in other area, and we mentioned that this occurs due to low position of the tongue, and also some characteristic of nasal pronunciation can be considered as characteristic feature for mouth breathing subject. This will result in an increase in the lower facial height, which giving a characteristic of long face, or what is called adenoid face, because as we mentioned, this occurs due to underdevelopment in the paranasal area. So it will result in increase in lower facial height. Due to mouth breathing, a dry and fissured lip can be seen, and also this lip will be incompetent. Habitual mouth opening result in overdevelopment of the buccal segment, which result in supra-eruption of the posterior teeth, and finally this will result in anterior open bite. During nail biting, as you can see in front of in this picture on the right side, the patient tried to brought his teeth into edge-to-edge contact anteriorly to get this edge-to-edge contact due to the biting on the tip of the finger. Also, after examination of the finger of patient with nail biting, you can see the second picture on the left side that there is a heavy cut on the nails and damaging for the fingertips. Fire habit, similar to the thumb habit. It's be characterized by anterior open bite, maxillary constriction with posterior cross bite, and also labial movement of maxillary incisor not as pronounced. Bad habit. The main aim for management or treatment of bad habit is to cease this habit by age of 5 to 6 years. Many children will stop this bad habit gradually without any aid, especially due to the increasement of the outhouse activities or school age, so the child will shy from this bad habit and he will stop this without any help or without any aid. A small number of children can persist in their teenage with this habit. Management of bad habits. These include either gentle discouragement or appliance therapy. Gentle discouragement can include psychological support and soft or gentle talk to the patient by explaining to them that this habit may produce some problem or complication and have some adverse effect on his teeth and bite. And this complication can be stopped or prevented if he stops this bad habit. This can be used when the patient or the child at age 6 to 7 years because they are able to understand the concept of cause and effect. And also they have the capacity for self-control and he may decide to stop this bad habit. Despite that, the sucking habit during the primary dentition have no adverse effect on the occlusion, but it is recommended to treat the habit in the deciduous dentition stage because at this stage the patient is still continue in his growth. So if this habit have some effect on the skeletal growth, so this effect will be continue. In addition to that, after during this age, the socially this bad habit will be not accepted. On the other point, this habit have a role in protection of medical problems or systematic problems to the growing child due to the placement of dirty finger or digit that can be placed in the mouth and some infections or inflammations may be occurred. The other type of management include the appliance therapy. These appliances are called habit breaker because it will break the habit. Firstly, we mentioned that the child can be discouraged gently, and if he not respond, the appliance treatment can be used to terminate the habit. These appliances that can be used to break the habit called the habit breaker. There are many types of habit breaker which can be used according to the type of bad habit. First of all, tongue crib or guard. This can be used to stop tongue thrusting during swallowing or thumb finger sucking habit. After placement of this appliance, which is either fixed or removable with a crib design, the patient will get rid of the habit with some retention period. In patient, this will be placed or consist of smooth metal grid, which can be placed behind the upper incisor. So when the patient try to put his finger in his mouth behind the teeth, can find this metal appliance, and also when he try to push or thrust his tongue anteriorly, also he will get this habit due to the presence of this appliance. The fixed type of this appliance can be cemented on the band, on the molar, on the first molar, maxillary first molar, and good success rate can be reported. Often, spontaneous reduction in overjet and overbite can be achieved with this passive treatment, even in permanent dentition. Is lip pamper. This can be used to stop lip sucking or lip biting habit, and this will, due to the presence of labial acrylic pad, this will prevent the backward pressure of the lower lip on the lower labial segment. This type either may be fixed or removable. Other intraoral appliance that can be used to stop the habit is oral screen. And this picture of the oral screen in front of you, as you can see that this appliance will close the opening of the mouth, so it's with some holes for breathing, and as you can see that this type of appliance can be used to stop most or many type of bad habits such as lip sucking or biting, thumb, finger sucking, nail biting, and habitual mouth breathing. The final appliance which can be used is finger reminder or bandage. From its name, it's finger reminder, so it can be used just for remembering, يعني فقط للتذكير تذكير الpatient. So it can be used as a reminder to stop nail biting and thumb sucking habits. This appliance can be used to stop the habits or bad habit and also have some degree of correction of the presented occlusal problem that may be a result from a different type of bad habit. So some problem can be spontaneously resolved and some problem can continue, which need comprehensive orthodontic treatment, especially in anterior open bites. Thank you for your listening. السلام عليكم ورحمة الله وبركاته.